The next few presentations cover material that Inova wants individuals to be aware of if they are going to be on an Inova campus a lot. Some of the material is for clinical healthcare workers. We have highlighted some things from each slide to share and help you complete the Inova annual quiz found in your green folder. Please pull the quiz from your folder and answer the quiz questions as we go through the presentations. It is an open book quiz. This first presentation introduces members of Inova's executive team, their mission and vision statements, and ways to help foster a safe culture at Inova. Dr. Stephen Jones is the CEO, or Chief Executive Officer of the Inova Health System, the Washington, D.C.'s region's leading not-for-profit healthcare system that serves more than 2 million people annually in its 5 hospitals and multiple ambulatory programs. He joined the Inova team as CEO in April of 2018. Meet the leaders of the Inova team. To us, they are considered the client or administrator. Dr. Rena Banzel for the Inova Alexandra Hospital, Susan Carroll for the Inova Loudoun and Inova Loudoun Cornwall Hospital, Dr. Steve Noring for the Inova Fairfax Medical Campus, Dr. Chand for the Inova Fair Oaks Hospital. Inova Fairfax Hospital is the largest of the Inova system with 928 beds and is nationally recognized for Regional Level 1 Trauma Center. Inova Alexandra is the second largest with 302 beds. Inova Fair Oaks has 174 beds. Inova Mount Vernon 237 beds, and Inova Loudoun has 311 beds. Inova's vision is to be among the leading health system in the nation. Their mission statement states they want to provide world-class health care every time, every touch, to each person, and every community we have the privilege to serve. Their values put patient care first in all actions and decisions. They value their people in all aspects of business. Believe they are all one team together. Their culture contributes to their success. Integrity. They ask that team members are committed to ethical business and patient care practices, and they strive to provide resources to help team members perform their jobs to the best of their ability in excellence. This helps make Inova a great place to work and a healthcare facility to recommend to others for employment and patient care. At Inova, the OSHA, or Occupational Safety and Health Administration guidelines for safety are used. There are 5 general categories of hazards: biological, chemical, psychological, physical, and environmental or mechanical. Ergonomics, practicing good posture and using equipment designed to fit the natural laws of the human body, can lead to fewer work-related injuries. Help prevent slips and falls. Universal fall precautions include: number 1, orienting patients to surroundings. Number 2, assuring all necessary items are within reaching distance. Number 3, remove all hazards and or clutter. Number 4, keeping the bed in lowest position with wheels locked. Number 5, providing non-skid socks. And number 6, purposeful rounding on floors. 2. There are other precautions to take to help prevent slips, trips, and falls. Keep floors clean, dry, uncluttered. Repair uneven flooring. Wear slip-resistant shoes. Post safety signs around slip hazards, and use proper lifting. Lastly, use the walk like a penguin technique if you have to walk on a wet floor or icy surface. Highlights for electrical safety. Most electrical accidents are preventable. Report hazards promptly. Use equipment properly. Use proper cords and outlets properly. Do not overload circuits. The Joint Commission requires accredited facilities to assess risk for electrical power failure, plan for loss of electrical power, test the entire emergency power supply system, and plan for periods of emergency power loss. The Chemical Hazards Communication Program promotes the safe use, storage, and disposal of chemicals. Safety data sheets provide safety information on each chemical and are found in the area chemicals are stored. Each department maintains a chemical inventory of chemicals in their department. For Inova Associates, the safety data sheets can be found on InovaNet under References. Latex allergy. Report to a supervisor or manager if you developed any symptoms that may be related to a latex allergy from wearing gloves. Symptoms include dry, itchy, irritated areas on hands. There may be a skin rash that blisters after 24 to 48 hours. MRI safety. For clinical, they must ensure that potentially hazardous items stay outside the MRI field. For patients, prior to entering Zone 4, all patients will be screened with a ferromagnetic detection device. And for all persons prior to entering Zone 4, all persons will be screened with both a non-ferromagnetic and ferromagnetic detection device. Inova's culture of safety is a partnership between leadership and team members aimed at protecting patients from medical errors. When an error or a near miss occurs, we must all commit to using it as an opportunity to improve our understanding of risk and learning from it by developing safer systems. Everyone has a role in building a culture of safety. How Inova values align with culture of safety. Patient always. They work with compassion to ensure every action they take puts the patient and family first. Our people. They create an environment of respect and growth where contributions are recognized and rewarded. One team. They believe they are the stronger together as a unified healthcare system, enriched by diversity and driven by a shared purpose. Integrity. They consistently uphold the highest moral and ethical standards and honor commitments. Excellence. They act with courage, hold themselves accountable, and achieve results at the highest level of performance. Key terms to understand about patient safety. A patient safety event is an event, incident, or condition that could have resulted or that did result in harm to a patient. Types of safety events. Adverse event. A patient safety event that resulted in harm to a patient. Sentinel event. A subcategory of adverse events. A sentinel event is one that reached the patient and results in death or permanent harm or severe temporary harm. No harm event. A patient safety event that reaches the patient but does not cause harm. Close call or near miss. An event that did not reach the patient. Hazardous or unsafe condition. A circumstance that increases probability of an adverse event. Not all patient safety events are preventable. A team is formed to perform an evaluation of a particular event or pattern of events in order to identify the root cause and to develop an action plan in response to those root causes. Safety Always is a reporting system used by Inova Associates to report errors, hazardous conditions, near misses, or great catches, employee injuries, and when processes or procedures are not being followed. The system is not to point fingers, but to facilitate organizational learning and process improvement. It is about their promise to keep patients safe with quality care. Team communication. SBAR is a communication strategy used to help ensure patient safety and continuity of care through an interactive process of communicating patient-specific information. The communication occurs when both the sender and receiver interpret the words in the same way. Team steps. is an acronym for Team Strategies and Tools to Enhance Performance and Patient Safety. Team Steps is an evidence-based teamwork system aimed at optimizing patient outcomes by improving communication and other teamwork skills among healthcare professionals. Some examples of this type of communication are checkback. It is a closed-loop communication strategy to ensure that information conveyed by the sender is understood by the receiver as intended. And CUS, a communication strategy you can use anytime you have a safety concern. The C stands for I am concerned. The U stands for I am uncomfortable. And the S stands for this is a safety issue. In this situation, use an assertive voice to state your concern, twice if necessary. If there is no response, elevate the concern to a supervisor or manager. You should have been able to answer questions 18 and 19 from this slide.